This is the second part of this presentation, heart failure. As we've discussed in the first part, heart failure is not the same as heart attack. I recommend that you watch the first part before you see this one so you understand this condition better. In the first part of this presentation, we talked about what actually happens in heart failure, that the heart muscle, which is basically a pump, it starts getting weaker and starts failing, which in turn will result in the heart not being able to pump out as much blood with each beat, reducing the ejection fraction, in turn leading to poor nourishment to the organs. We've also talked about heart attack not being the same as heart failure. We also talked about the symptoms of heart failure, which include excess fatigue, shortness of breath, coughing, fluid building up in the lungs, around the lungs, swelling in the ankles, legs, abdomen, and puffiness of face. How to know if someone has heart failure? There are some basic tests that are done by your physician based upon the symptoms. These basic tests include blood tests, chest x-ray, which typically will show an enlarged heart, ECG, and an important test called 2D echocardiogram, which is basically an ultrasound of the heart. It will determine the heart's pumping capacity, as well as give information about the chamber sizes, their thickness, and any problems with the valves, and so on. There are other tests that are also done in many situations. These include stress test for the heart, sometimes an angiogram, also a CT or MRI of the heart. Bear in mind that the tests tend to vary from person to person, because heart failure, as we've seen in the first part of this presentation, can have many causes, so not all tests will be relevant for everyone with heart failure. Why is heart failure such a serious problem? Because it leads to many complications. Most importantly, the quality of life is going to be poor if someone has heart failure, especially if the heart failure is fairly advanced. And in most cases, unfortunately, heart failure tends to worsen over time. Irregular heart rhythm can result from heart failure. Now, this irregular heart rhythm can lead to a stroke. We talked more about stroke in the presentation stroke, so you may want to go over that. And irregular heart rhythm can also lead to blood clots in various organs and tissues. And sometimes these blood clots can lead to a life-threatening complication. Heart failure can also lead to a heart attack, kidney and liver problems, fluid building up in the lungs, causing severe shortness of breath. And of course, because of all the different complications that can result from heart failure, frequent hospitalizations may become necessary. Premature death, unfortunately, is known to occur amongst heart failure patients. Let's briefly go over some important aspects of treatment for heart failure. I will not be able to talk about the various aspects, modalities of treatment, because it is an extensive topic and is beyond the scope of this presentation. But I'd like to emphasize upon a few important facts. You have to keep this in mind. If you have heart failure, you, your primary physician, and your cardiologist are a team and should work together as a team. There needs to be effective communication between all team members for proper care. Diet and lifestyle modifications are extremely important. Sodium, meaning salt intake, will need to go down drastically because that can contribute to worsening of your symptoms. And your daily fluid intake will need to be limited. And this is something that you will need to discuss with your physicians. If you are a smoker or drink alcohol, you will need to quit doing both of those because they tend to worsen heart failure considerably and sometimes are responsible for the development of heart failure. Regular exercise activity within your limits upon the advice of your physician is important, and your weight will need to be monitored regularly because any sudden fluctuations in weight will indicate worsening of heart failure. Medicines play a vital role, a life-saving role you could say, and there is a standard set of 4 to 5 medicines which are always prescribed for heart failure, and these medicines will be prescribed by your cardiologist and will need to be monitored by your primary physician. If you have heart failure, I'd like for you to remember the following. Make sure that you write down your main concerns before the appointment, especially if there is any sudden increase in weight, or if you've developed any new symptoms, or if your symptoms seem to be getting worse. And clarify all of your concerns regarding your symptoms, diet precautions. If need be, meet with a dietitian or a nutritionist. Clarify your concerns regarding your test results and when you will need to come in for follow-up, etc. And make sure that you ask about the purpose of each medicine being prescribed for your own understanding. And keep in mind that for many brand name heart failure medicines, there are equally effective, cheaper brand name alternatives, and find out from your doctor if you are a candidate for them. And don't forget to inquire about any common potential side effects of the medicines being prescribed for you. In some cases, procedures are also advised for heart failure. For example, if there is irregular heart rhythm, then a pacemaker and or a defibrillator implantation might become necessary. If the coronary arteries, these are the arteries that supply blood to the heart muscle, if there are blockages in these arteries, then angioplasty with or without stenting, or even bypass surgery. If the heart valves are defective and that is responsible for heart failure, then valve repair or replacement surgery will be advised. For severe heart failure, transplantation of heart. And certain other procedures are also done if needed. I'd like to end by saying a heart failure can be a devastating diagnosis. If you have heart failure, it is imperative that you choose your doctors carefully and work as a team. Report any sudden worsening of symptoms to your doctors immediately. Do not neglect any new symptoms. Modify your lifestyle if you've been advised to do so. Please do not smoke or drink alcohol. Take all the medicines as prescribed at the times prescribed. And do monitor your weight on a regular basis at home. With these steps, I hope that you will be able to maintain a good quality of life. Thanks for watching.